So this is the maxilla. You can see the maxilla, edentulous maxilla. You can see the sockets of all the teeth. Beyond the second molar area, can you see the tuberosity here? This is the tuberosity area on both the sides. So beyond the tuberosity, medial towards the mid-palatal line, can you see here? I'll show you in close. This is the lateral pterygoid plate and this is the medial pterygoid plate. Have a look. Lateral pterygoid, medial pterygoid. This is tuberosity of the maxilla. So you have to do the osteotomy towards the medial pterygoid. So the area between the medial and the lateral pterygoid. So there your implant has to engage in corticobasal implant system. Okay. So the approach is through the tuberosity area. So usually we place different types of implants here. One is PTI, that is a tuberopterygoid implant, which is placed along the posterior wall of the maxillary sinus. So beyond that, you can place these implants into the and start the osteotomy. Little angulated towards the medial pterygoid. This is the lateral pterygoid. The area between the medial and lateral pterygoid, that is the pterygopalatine fossa. There we have to engage. I'll start the osteotomy now. With the osteotomy, engagement area, this should be the direction. So usually it will be some 15 to 20 degrees medially from the tuberosity, so angulated towards the medial pterygoid. So we can angulate towards the medial pterygoid some 15 to 20 degrees, and if their osteotomy is good, it will engage in the pterygopalatine fossa. This should be the area where you have to engage. So in this region, to engage into the pterygoid place, so if the angulation and osteotomy technique is perfect, you can engage up to 26-30 mm also you can engage. So beyond that, if it is above 35 mm means it's difficult because of the presence of maxillary artery, the branch of issues. Many doctors will complain that no need to place double pterygoids. You do have complications. You will not have any complications if you can do osteotomy properly and follow the rules. So it's done. It's engaged. It's engaged. The area between the medial and the lateral pterygoid. Can I have a look?